Hi there. In this video, we are going to have a brief overview of the protein energy malnutrition, or the modern name of which is severe acute malnutrition, or SAM. So this severe acute malnutrition is same that was previously known as protein energy malnutrition. So it is basically defined as a reduction in the weight for height ratio of a child or so on. So there is specific height to weight ratio. For example, if there is height y, then at this height there should be standard weight x. However, if this weight for height ratio is decreased, then person is said to be malnourished, and it can be due to reduction in either protein intake or reduction in calorie intake. So the protein content of the body is divided into the two compartments. One is somatic compartment, which basically includes the skeletal muscles of the body. Another one is visceral compartment, which includes the visceral protein, basically synthesized in liver, and the principal protein synthesized in liver are the plasma proteins, including albumin and immunoglobulins and so on. So this in respective to the decrease in the protein in these compartments, this severe acute malnutrition divided into the Kwashiorkor and Marasmus. When there is decrease in somatic compartment proteins, there is loss of skeletal muscle mass, and it leads to the marasmus. However, when visceral protein decrease, there is decrease in plasma protein, and it leads to the Kwashiorkor. So principal differences between Kwashiorkor and marasmus are: in marasmus, there is decrease in calorie intake. However, in Kwashiorkor, there is decrease in protein intake. When there is decrease in calorie intake, body catabolizes the muscle mass as well as the subcutaneous fat to generate calories for its usage. So, as a result, what happens? The muscle and extremities of the patient are emaciated or wasted, and patient have a wasted appearance. Okay. However, the albumin levels or plasma protein levels are normal or slightly decreased, and the patient will be having emaciated or wasted limbs and large head, and patient will be anemic, and there will be also vitamin deficiencies and reduction in immunity due to compromised or malnourished state. However, in Kwashiorkor, protein intake is decreased, or the body protein content is decreased, and this decrease in protein content can be due to weaning of child, when milk is dropped out, and the child starts to get food from carbs diet. It can lead to the decrease in protein intake and Kwashiorkor. Moreover, the person or patient having protein losing enteropathies, in which protein are lost from intestine, or nephrotic syndrome where protein are lost from kidneys, or burns when protein are lost from skin, can lead to the Kwashiorkor. In Kwashiorkor, muscle mass and subcutaneous fats is spared. However, the plasma albumin level are decreased, and when albumin level are decreased, there is edema, because albumin maintains the hydrostatic pressure of the blood vessels, and when albumin is lost, there is development of edema. Moreover, patients of Kwashiorkor have skin lesions. They have hypo and hyperpigmented and these squamation areas. As a result, their skin have appearance of flaky paint appearance, or you can say old paint on the walls like appearance. Moreover, their hair color changes. The hair may be pale, or you can say white. They will lose their color, and their liver also will turn into fatty liver, and they will be also having reduced immunity and increased risk of infection. So these are basically principal differences between Kwashiorkor and marasmus, which are two principal manifestation of the severe acute malnutrition. Thank you.